What's up, everybody? Welcome back to the show. We are excited to bring you guys another episode of Optimized Health Podcast. Mandy Livingston, what's up?
Listen, I'm over here. I'm a little nervous about this one, I'm going to be honest.
Really?
I do not have a dentistry phobia. I just don't want the pain.
Yeah.
I mean, it's just pretty much like, I don't want the pain from something being wrong. I don't want the pain of something being fixed.
You just want to be in ignorant bliss.
I just want to be almost like I Dream of Genie Land, where I can just blink it in and blink it out.
Yeah.
So,
well, to that point, we have Dr. Kukreja on with us today. We got connected to him through Julie Davis, who went up to his office in Franklin. And so one of the we've never had a dentist on the podcast, so I'm super excited about this.
I am too.
And I think one of the things that is really fascinating is about his approach, his partner's approach to dentistry from a very holistic standpoint, which is something that we're super passionate about with our hormone clinic at Optimize You, as well as just this podcast and this educational platform. You studied at the University of Alabama, Birmingham.
Yes.
And then moved to Franklin, Tennessee to join this practice. So thanks for coming on the show.
Yeah, absolutely. I'm excited to be here.
Yeah. So for those of us, give us a broad picture, right? When we talk about holistic dentistry or biological dentistry, what does that mean?
So holistic dentistry kind of looks at the connections of the oral cavity with the rest of the body. You know, we don't want to like isolate that anything that goes on the mouth is just restricted to the mouth. You know, we believe overall that every tooth is basically like an organ and is connected to the rest of the organs of the body. So we believe in the meridians, natural energy flow. So anything we do will have a link, you know, to the rest of your body. So that we take in mind with any sort of like treatment plan we come together with, and just put our patient's health first, you know, systemically.
How long has this been a part of dentistry? Is this something fairly new, or has this been like, no, this has been out for years out west, or?
Yeah, so it's, I feel like it's picking up some traction now, but it actually roots back, pretty far ago. Weston A. Price, he was kind of the pioneer of finding that link between like diet and dentistry. So, you know, we kind of take his principles too with everything we do in practice. He basically did a lot of studies back a few hundred years ago, looking at like the connections of diet. You know, he went out in Africa, did a lot of like case studies, and saw the risk of cavities in certain populations. And he actually found a lot of cool things, like how people's jaws were structured and how they had a lower risk of cavities. And the biggest thing that he found was that they basically focused on whole food diet. You know, didn't have any of the things that we have these days, like processed foods, high sugar content and all that. So that kind of rooted the formation of like holistic biological dentistry in that looking that diet has a big role too. So biological and science principles rooted back then, and now it's kind of picking up traction with things we do today in dentistry.
So we were talking earlier about just the connection, right? As far as the holistic approach, you know, why I got into hormone optimization. And one of the main reasons I did it, there's a couple of reasons, but one of the main reasons is my mother, who's now 74, was in an era as a female, as a menopausal female, where she was not offered hormone replacement therapy. And as she got older, probably about 5 years ago, she started having a lot of tooth decay to the point where she was going to need dentures, and she could not find a set of dentures. She probably went through 6 or 7 pairs of dentures that just would not fit her mouth. And then she would go, you know, to a reconstructive surgeon. They're like, well, we need to, you know, put some post in there. But then she didn't have the bone quality because she had lost her hormones. And you know, grafting bone and all that. It was just such a big process and and unaffordable for her. And so it really was one of those things where I thought, man, how many women, right? That's just a small example, but how many women have been mistreated, and not given an option of something as simple as estradiol that could have preserved her bone health. So yeah, dentistry, I don't know a whole lot about it, but it actually had its roots in why Optimize You exists.
Yeah, no, that's crucial. And I love that connection because we see that a lot with certain stages of life, like pregnancy, menopause, like people's just oral cavity is compromised, you know, whether it be the periodontal health, like gum health, increased risk of cavities, lower bone density. And lower bone density, as you know, is it holds those teeth in. So we need to preserve that bone health. If we need to do any treatment like implants or if they're missing teeth, it's a big predictor of their overall health, so that's awesome that there's a hormone connection too. And I honestly want to dig deeper into that when I progress in my career too, to see what we can do and optimize that.
I know a guy. I know a guy can help you out with that.
I know that's how this worked out perfectly.
I remember being like, as a kid, you just thought once you hit a certain age, you just don't have teeth anymore. Like that's just how it goes. You just don't. Just like your hair turns gray. You don't have teeth anymore. So it's good to know and refreshing to know that there is a link between certain things that where that does not necessarily have to be a thing. I don't want to be toothless. You know what I mean? Like, I don't want that to happen.
It's a big fear for
I've kind of grown up with them, right? So I would kind of like, we have a relationship. I'd like to keep them. So, what would you say would be one of the biggest causes outside of hormonal depletion? What would you say is one of the biggest causes for tooth loss and or decay outside of hormones and or diet? Is there something different? Yeah,
so that's a great segue. This is actually something that I love to talk about with everyone. We focus on something known as the remineralization protocol. So this takes place early on in life, even because our biggest thing is preventative. We want to stop cavities obviously before they even happen. We, as a practice, our practice is very conservative. So everything we do, we believe that anytime you drill on a tooth, the tooth is never the same because you really want to preserve that natural tooth structure with anything you do. We don't want to, overdo anything to the tooth structure because that really has a role in the overall tooth structural integrity. So the remineralization protocol basically focuses on using the mineral hydroxyapatite. So that's our kind of alternative to fluoride. Fluoride has some other side effects that we worry about in terms of like neurotoxins. And so we like to focus on hydroxyapatite, which is a more natural way to remineralize the teeth, because the tooth is actually comprised of calcium hydroxyapatite. So if we can naturally replenish that, whether it be using mineral toothpastes, doing things like minerals, excess minerals in your diet, more supplementation, that really helps in keeping that structural integrity. So if we can start that on early and focus on those principles, we can prevent decay, even like preserve gum health, preserve bone density, and that all plays back into like keeping your teeth longer, So
is there a brand or a way that somebody can get that form of toothpaste?
Yeah, so hydroxyapatite, there are a lot of good ones out there. A few brands that come to mind like Risewell, Dr. Jen's. There is a great, source of nano hydroxyapatite, especially, which is just a better form that can be absorbed by your tooth.
Smaller.
Yeah, smaller particle. So we see a lot of good results, especially in the carious lesions that we see in between the teeth. So whenever it's still in the enamel, we believe that it can be reversible or remineralized. We don't have to go in there and drill and fill per se. So we can, reverse that and help it kind of grow back and then just monitor instead of doing a filling, because every time you do a filling, you have a risk of it becoming larger and then, ruining that structural integrity of the tooth. So we want to stop that before it even happens.
So what do you do because I would imagine, right, majority of our patient populations probably had plenty of cavities, plenty of fillings.
Yeah, I got some in here.
What is the hope? Or is there, for somebody who's had fillings, the what'd you call it, the drill and fill?
Drill and fill. I love that.
Yeah. I'm like, that's a slogan.
I know, right? That's a T-shirt. No more drill and fill. Yeah.
We have normal is not optimal. I think dentists should have drill and fill.
Yeah, that's a good shirt.
So, what can you do in that situation? It's probably unique to the individual, right? But as far as like if the tooth structure has already been compromised, are there things is it more just like you're just trying to stop the bleeding at that point and it's like no more tooth decay, or is there anything that you guys do differently than, all right, sorry, it's too far gone, we got to keep, root canal or crowns or what have you?
Yeah, so it goes back to the same cascade. Like once you have them, like we can just maintain and hopefully there's no recurrent decay underneath the filling, because that can happen as well. But we want to help prevent that cascade because in traditional dentistry, it kind of moves from filling to crown to root canal with crown. And we want to prevent that too, because with root canals, we see increased risk of infection. And that is also one of our big pillars, is to remove infection from the oral cavity. So what happens with a root canal is it severs kind of the connection with the natural meridian flow, and we see excess, increased risk of infection because bacteria kind of lingers in that tooth. It becomes a dead tooth, once they do a root canal. They take out the nerve, the blood vessel, so that's like the vital organ of the tooth. So that's something we're trying to preserve. So we, don't like to go down that route, and it just follows the cascade. So anytime there's like a silver filling or a root canal, like those are things we ideally not want in the mouth, because with the silver fillings, we see spread of mercury every time you masticate with your saliva flow. So that's something we do in our practice a lot as well, is to remove the mercury and replace it with a more biocompatible material. And with the root canals, that's something we definitely want to monitor and make sure there's no infection in the oral cavity being left behind. We can usually see that with a CT scan, localized CT or a full cone beam scan. And we want to just see that if that's contributing to anything health-wise for the patient, because we do see a lot of like systemic conditions these days being linked to infections with root canals. Yeah. So that goes back to kind of our meridian chart and looking at which organ is related to which tooth. And we see a lot of those links, in daily practice. So
do you guys have a CT scan in your office?
Yeah, we have the full CT cone beam that we do a lot, and it helps us diagnose a lot better than just doing the two-dimensional x-rays like the PAs and bite wings. We like to do that because we can also visualize like the other anatomical structures nearby the teeth. So like the TMJ, the airway. Airway is another big thing we like to look at in dentistry, especially when kids are young, with orthodontics and airway, because that has a big kind of role in how they're going to sleep and breathe later on in the future, preventing things like sleep apnea, expanding their jaw when we can. So the CT just kind of offers, a lot of clues into what all is going on. And then we kind of like to match it on with like lifestyle symptoms and stuff. Yeah.
Let's stay on the silver.
I know I've got some.
Yeah, me too. Yeah. So
I know I'm over here nervous. I'm not lying. I'm nervous.
So how do I make an appointment? I'm just. So are there? I've got a couple questions. You talked about the mercury. Are you looking at labs with that, or is it just the assumption, what you already know, not really an assumption of like silver has the mercury? So
what the data's already shown.
Yeah, you recommend just getting it all out, and then what do you use instead?
Yeah, so I personally do recommend getting it out, just with that source of mercury being there, and it's just, we've seen like that vapors can be released from the filling. Studies have shown. We closely work with the IAOMT, which is an organization of toxicology that looks at the safe way to remove the mercury filling. So just with the research and studies that we've seen, we prefer to have the mercury out. But I do recommend all my patients to get a hair analysis or a blood test, just to see like baseline starting levels of heavy metals. So we're looking at like lead, mercury, a lot of like metal alloys are used in dentistry as well, whether it be silver fillings or the amalgam fillings, or even silver crowns. A lot of porcelain crowns have silver under them. Okay. So there's a lot of like sources of metals that can be found in the oral cavity. So I like to start off with a test just to see baseline levels, because even then we can use it and compare like after removal how we're looking. So, and to see, I always like to ask my patients if they've had any like cognitive symptoms, because with mercury we see a lot of like brain fog, memory loss, just kind of fatigue, chronic fatigue. So all that, kind of looking at all those factors, we like to see if this is a right treatment for them, is to remove it. And we like to remove it, quote unquote, safely using the SMART technique. So obviously we don't want to just go in there and drill it, because that releases a lot of vapors. Right. So we use a lot of safety protocols there, using things like the rubber dam, special suction systems to make sure when that filling comes out, it comes out in fragments and goes straight into the suction. And we also make sure our patient is on like charcoal and Corella pre and post removal. As a binder? As a binder, exactly. And then doing like the full body covering. Even the staff, like we're wearing special masks. Because even for us, it's a risk, to remove them. So we want to make sure that both parties are safe there. So yeah, it's the SMART technique that we use, and that's the International Academy of Toxicology with Dentistry that's come up with that. So it's very more involved than just going ahead and replacing it. You know?
Okay.
Yeah.
Listen, mine came from the 80s when we weren't even in car seats and or our parents were smoking in the car with the windows up with us. Like, I'm probably the most toxic.
Or you could be like me. I had a filling removal by chewing a gummy bear.
Oh, yeah, that just happened. That just happened.
I mean, it didn't hurt.
Yeah.
I'll tell you that. I was like, is there a rock in this thing?
Yeah.
Filling.
A mercury rock.
Yeah.
I haven't had it replaced, so maybe I need to come see you.
Come on by.
Yeah.
Field trip.
So, okay, one of my thoughts is teeth whitening. I don't even know that we were supposed to talk about this, but I'm sure you've got an opinion.
It's a good,
because I think a lot of people do it, right?
I've done it.
Walk us through your opinion. Are there alternatives if you don't recommend, current treatment for that? And yeah, I'd love to hear your opinion.
Yeah, absolutely. So most of the teeth whitening systems out there are obviously peroxide based. So a lot of patients note sensitivity. It is one of the strongest ways to go up a few shades if you want to. And some of our patients still do it, but I always do just warn them that it is a little abrasive when it comes to, your enamel and sensitivity wise. So I like to always start with more natural whitening methods. A lot of good ones out there actually have the mineral hydroxyapatite and certain minerals that can polish away stains, and just as a more natural, coconut oil is also a very natural whitening system.
Like swooshing?
So, yeah, just swooshing. So coconut oil pulling is a good way to start.
I have that too.
Yeah. Or using, there are a lot of good whitening powders these days with hydroxyapatite and coconut oil that can remove a lot of stain. I always tell my patients to start off with that. So like Luminex, Boca, Snow, those are all really good, gentle whitening systems.
Okay.
And then if they're obviously looking for a big change, peroxide might be an option for them, like a peroxide or light-based whitening system. But I always like to try off, a more gentle, natural system before even recommending anything else.
You feel that in your gums too.
Yeah, it's pretty.
Yeah.
For some people, especially, it can be they can be hypersensitive to it.
It's like you build up a tolerance to it.
Yeah,
I did it the first time I did a competition.
Oh, really?
Yeah, I was going all out.
Yeah.
I mean, all out. Matt had me on everything.
Yeah.
Did you do the desensitizer with it?
I did not.
Yeah. Some
but
of
it
those
just
have them with
it just initially started off like, oh my Lord,
Yeah.
and then it kind of I guess I don't know, maybe it boiled all the stuff out. I don't know, but it eventually, and you can feel it bubbling and everything.
Yeah.
But it did it made them somewhat sensitive. To cold drinks and hot drinks.
For just a period of time.
Yes, for a
right?
period of time. But then when I stopped it stopped.
Yeah, because it's actually reacting with the particles in your enamel to remove, what's causing the stain.
Well, I think about, when I was a kid, you got peroxide, you fell, you put peroxide on your wound, and we called it boiling it out, because it bubbled up and everything. So I pictured it being the same concept.
Much more concentrated, right?
Yeah.
Oh, yeah.
More,
Yeah.
And that's a big thing. You got to think about, in traditional dentistry, I feel like dental materials, that's another big thing we really focus on is for certain patients, we do sensitivity testing because, a lot of dental materials, you can find things like acrylates, plastics, even things like waxed floss, that people use every day, Glide. It has a lot of microplastics in it. So we like more natural alternatives like coconut oil derived floss. Cocoa floss is a really good one. Unwaxed, just nylon unwaxed floss, something super basic, or using a water pick. But, just really being aware of the dental materials that people use, in root canals, they disinfect with bleach. That's not something that you think about, that's going in your oral cavity and you're like, oh, wow, I want that. It's just something to be aware of, so we really take that into mind too. Even the composite materials we use for fillings are totally acrylate free, really good for people with sensitivities. So yeah, that's just something to keep in mind before you go to the dentist is what's going in your mouth, before you do it.
When you went to school, and sorry, Josh,
go ahead.
But when you went to school, were you learning about the bioidentical options, or what did you learn? And then you came out and went, I wonder if there's a different way.
No, not at all. So you don't really learn any of this stuff in school as of right now. So, holistic or biological dentistry, alternatives is not really part of the curriculum. Yeah. So I've been fortunate enough to, once I got out of school, meet Dr. Forbes, get into tune with his practice. And then I also just went out, I was fortunate to meet a lot of, big people in the field, like Dr. Wall out in Utah. I recently came back from Costa Rica Biohealth with Dr. Fernandez, who's with Swiss Dental. He's one of the, they're one of the implant systems we use. So a lot of biological big pioneers that are doing great things in this field. So I learned a lot from them, and I'm a lifelong learner, so I want to continue to learn. But so that's kind of how I fell into biological dentistry. And fortunately, this was the first job I had out of school too, so I didn't really have to do anything traditional. So now I know, like, this is the way I want to practice. There's no really turning back. This is, because always, like, even during school, like, there are just some things I was like, there's got to be something else out here, So it just kind of all fell into place, and I'm excited for the future too from here.
Let's talk about anesthesia.
Yeah.
How do you guys approach local anesthesia, maybe even some sedation? I know that's a very common thing in dentistry. So what's your all's approach?
So, we obviously, the first line is kind of local anesthesia. Even with that, some people have sensitivities. For sensitivities, we usually use anesthetics without epinephrine. So like Carbocaine, Sitnest, they're a little shorter lasting, but like they are useful in times like when a patient's pregnant or they just have sensitivities to certain anesthetics. Because with epinephrine, we see a lot of other bodily responses to increased heart rate, all that stuff. So, flushing, so sometimes we do use epinephrine, especially for longer procedures like surgeries, because we need that vasoconstrictor action and the longer lasting. But we have those two kind of things in our back pocket. And then for sedation, we do either oral sedation or like IV in bigger cases when we need it, especially with dental anxiety. I feel like it does help a lot. And nitrous oxide is also an option.
So they're not just rolling in there and you're just like, lay down and bite on this strap until I'm done.
Oh, no.
Or hold tight because here it comes, So that's good to know.
The experience is, one of the biggest parts of it. So we want to make sure our patient is comfortable the second they walk in. And if that means some form of sedation, that's what we offer, So we kind of list out all of our options, and then it's case by case, whatever the patient feels like will be best for them, so we can get through the treatment and have them comfortable. That's what we go with.
Well, I'll just say from a dental anxiety standpoint, this is the first time I've been this close to a dentist where I wasn't sweating,
Take that as a compliment.
So, what is it though? What is it that makes you like that?
I just had one bad experience with someone, and
were you young?
No, it was probably, I never had a problem until about 6 years ago, and he just was rushed, and he was too busy, and just didn't do the proper anesthesia, and he needed to get going, and so I was like gripping the chair trying, because so anyway, and it's what's interesting is like it truly is this sympathetic response, where now I have zero. I'm never anxious about stuff like that, and it's like as soon as I walk into a dental office, it's like, oh my gosh,
your heart starts speeding up.
Yeah.
Is it a smell or a sound that triggers you, or just the fact that you're
presence?
I should say, or just the fact that you're in there at all. Interesting.
Yeah. It happens, like you said, the sympathetic, and just like that experience always sticks with you. So we want to make sure it's a good experience. And the pressures of modern dentistry, I feel like sometimes people do feel the need to be rushed just to like see more patients or just make it happen. And then every step is crucial. So if any step is rushed, that can kind of downgrade the experience. So we really want to make sure everything is like the anesthesia, good profound anesthesia, so the patient's comfortable throughout, making sure even the anesthetic injections are painless, because there are certain techniques that can make it more comfortable. So
that's nice, because I've never experienced that being painless.
Right.
That's one of those where you're gripping. You're like, all right, I know what's coming, and I can deal with that. I don't want to, but I can.
Yeah.
But that's nice.
Let's talk about lasers.
Yeah.
So what do you guys do with lasers in dentistry?
So there are a lot of uses. We use the photon laser, which is super versatile, tool in dentistry. You can do restorative procedures, periodontal recontouring, surgical procedures. I personally use it more for surgical procedures. And the most common thing I use it for is whenever we're removing teeth, infected teeth or root canals. the biggest thing we want to ensure is that every trace of the tooth is removed. And that even includes the periodontal ligament, which is associated with the tooth. So what we see is if a tooth is just taken out and the socket is not properly disinfected with the ozone, the laser, we see recurrent infections even with after extractions, even if you're taking the tooth out, because you're leaving that ligament in, which holds traces of the tooth. And we can see things known as cavitations, which are basically like voids in your bone of improper healing or necrosed dead bone. So what we do is when we remove the ligament, we ensure that there's like proper bleeding, healthy bleeding of the socket, because that's what's going to help it clot and, you know, form the healthy bone. And then we do platelet therapy along with it, which is where we draw the blood, shake it up in a centrifuge, and mix it with some synthetic bone graft.
Okay.
So we make sure our bone graft is not sourced from like other humans or, you know, other animals like xenograft. We make sure it's purely synthetic, made in the lab, which is the most biocompatible option. We mix that with the blood, and then we place that back into the socket almost as a bone graft or bone preservation, to help that bone regrow. So we can, if we need to place like an implant, say, that's what we need to do to preserve the bone. But even if we're not placing an implant, for the health of the jaw, we need to put that bone back in there with the platelet. The platelet obviously has all your like growth factors, stem cells, all that stuff we want to like naturally regrow the bone. So we place that back in, and then we let it heal. So that's kind of what we do. And the laser is used for that step, the periodontal ligament removal, the disinfection of all the infection associated with the tooth.
Okay.
And then we mix that with the ozone, which is we do it through the gas.
Yeah.
And that extra molecule of oxygen on the O2 just really helps that sterilizing effect. And we use ozone for a lot of other things, but that's what we use it a lot for, is for infections. And we place that in the socket to help it heal.
Okay.
Yeah.
So do you do anything, you know, ozone therapy is pretty popular in the longevity space, right? It's, but your ozone is focused in the dental region, right? You're not doing IVs and...
We're not particularly doing IVs, but we do like refer to a lot of preferred providers if like a patient has other systemic things going on where we feel like it could benefit. I'm a big advocate of ozone, so I do like kind of refer them out for that. But yeah, in our practice, we mostly do it for like dental infection, you know, or regeneration, like kind of how I was talking about. Yeah.
I've got thoughts going in my brain.
Go ahead.
Well, I'm very curious about how, because you're in Franklin. So I'm over here scheming on how we're going to get him into Chattanooga. That's what my thoughts are.
Oh,
I'm just saying. But I seriously, when Julie was talking about this, I was like, I'm looking at her going, because she was like, you know, I didn't want a whole lot of anesthesia in this. And I'm looking at her going, are you crazy? Yeah. Like, have you lost your mind? Like, I'm all for being as holistic as I, but then I've got to draw a line, you know, and because I was thinking that maybe, you know, you just got in there and you're like, hold my hand, sister. Like, here we go. But, you know, so it's interesting to get deeper into it and know that there is a different way, a better way. Because I'm just thinking about my body response. If I'm doing things like eating certain things that are sourced from certain places and things like that, I just automatically assume when I went to the dentist that was just going along with me. Again, just like with doctor's offices and things like that. Yeah. There has been such a turn in how we are allowed to care for ourselves now that is so mind-blowing. Like, it's mind-blowing that you just take for granted that the treatments were the ones that were best for you. You know what I mean? And that's not to say anything right or wrong against, you know, previous providers. That's not, you know, it's not to shame on them or anything. It's just a matter of thinking there's a better way and forging that. So kudos to you for forging that, you know, better way.
It's just the way, like, sometimes how dentistry evolved in the past. And then it's just a matter of thinking outside the box, like really thinking is this is good for your body or not? You know, what effect is it having on my health? And then when you really get deep into that, then you can kind of, you know, back what we're doing and see, we've seen great results too. So that kind of just, you know, puts everything into perspective.
Helps.
Yeah.
I would imagine you started off talking about nutrition, diet. So I would imagine that you guys do a lot of patient education, right? So this is probably not for the faint of heart. Somebody who just wants to get in there and get a feeling, you know, taken care of. What is your all's approach with nutrition? how do you guys encourage your patients to think about nutrition and diet and lifestyle? I just love to hear, I always think of stewardship or ownership, right? We have to take ownership of our own health. So how do you guys try to impress the importance upon that to your patients?
Yeah, so we prioritize that a lot, and it goes back to the very basics, like very rudimentary things, and that's what we want in our diet. Super basic foods. We obviously want a good blend of macronutrients, balanced diet, but really focusing on the basics, like getting your proteins, healthy unprocessed carbs, healthy fats. So and we also focus a lot on minerals, natural sources of minerals as well. So looking at like organs, that's a really good source of minerals, like beef liver, cod liver. Raw milk even has a great source of minerals. So, we like to tell patients about that. Yogurt, probiotics, probiotics are directly linked to your gum health because that, microbiome can be associated with your circulatory system and how the gum is inflamed or not. So yeah, just basically like really basic, foods that have all your mineral vitamin profiles, nuts, avocados, like I said, yogurt, raw milk, meats, unprocessed foods, really basic stuff. Yeah.
All right. I'm going to shift gears on you. I'm going to go back to having metal in your mouth.
He's stuck on this.
No, well,
we're coming.
I've got kids.
Here we come.
Let's talk about braces.
Oh, yeah.
So, right, you want to talk about having some metal in your mouth.
No joke.
Yeah, are there alternatives or different ways that you can limit some of that, or what is it even made out of? And yeah, I'd just love to hear your thoughts on braces.
Yeah, so there are ways you can limit, but it all goes back to like when you're growing up. So it's all about targeting that stuff early, because if we don't get the jaw structure optimized early, then later on you may need things like braces or like more extensive treatment, sometimes even like surgical treatment to expand your jaw. But if we start early, we can all do that naturally, because kids, it's much easier to kind of mold the maxilla and expand naturally. So we really believe in expanders. That's a great way to naturally, make space for your teeth. Even if you get enough expansion, your wisdom teeth can come in, so you don't have to worry about, wisdom teeth becoming issues. That's a whole nother story of wisdom teeth removal, and we're not, big advocates of that. If we can keep the wisdom teeth, that's something we want to keep, because again, it goes all back to like, it's a part of your body. It's an organ of your body. It's holding the jawbone back there. We don't want to just take them out if there's no reason to. Obviously, if there's infection or the gums get infected, that's a different story, but we want to keep your wisdom teeth. So expansion helps all your teeth come in naturally. They get aligned, and kind of how I was talking about earlier with Weston A. Price, the studies he did in the communities where these people are just eating pure unprocessed foods, like nothing crazy. They all have like perfectly aligned teeth, their wisdom teeth are in, they don't have any cavities, and they're not even like brushing their teeth. They're really careful with it, like how we are, but it's just going back to their diet. So like, that's how much of a role it has. So yeah, early on, like with orthodontics, we want to expand the jaw. Tongue ties is a whole nother realm. So if there's any like myofunctional kind of restriction there where the tongue can't have the proper palatal seal, we're having mouth breathing, symptoms like that, we want to recommend myofunctional therapy, doing tongue tie releases, expansion, and those are all kind of natural methods to expand the jaw and not having to worry about a restricted jaw. In traditional orthodontics, they sometimes recommend teeth extractions, but you don't really need that because that will shrink your jaw. We're more looking at expanding it and, optimizing your body's potential for accommodating the teeth, your airway, and you can prevent all these things in the future, like sleep apnea, braces, surgery.
Exactly.
So it's just about targeting early.
Yeah. Wisdom teeth is a lot like gallbladders. When I was in my training, I remember the general surgeon I used to work with, he would say, somebody'd come in and, nobody knew what to do with them, right? They've got some GI issues and constipation or diarrhea and a little GERD. And he would be like, yeah, let's just take your gallbladder out. And they're like, do I really need to do it? And he's like, well, just so you know, you can't get to heaven with a gallbladder in. I mean, it was like we just took gallbladders out of people,
That's a good analogy, good connection.
I'm like, do we really need to be doing that? So if we're looking at preventative around braces, most of us are reactive, right?
Yeah.
The parents in the room, it's like, wait a minute, your teeth are crooked.
They're all jacked up.
So is there a time, if I'm thinking about my 3-year-old or my, where it's like, hey, preventatively, we need to take, this 2-year-old to you guys so that they can evaluate the jaw and then give us that opinion. Is that something that you guys recommend?
No, that's exactly what we recommend, is to just at home, like early on, scope out any symptoms. Like mouth breathing is a big one. Just like sleep quality, if you feel like your kid, the teeth aren't coming in properly, anything like that, just basic things. Like definitely, I think honestly, all kids should get evaluated for how their teeth are coming in and how their palate is in terms of size. If there's any like tongue ties, airway issues, I think everyone could benefit from that. Obviously, there are cases where we don't need to do much, but even myofunctional therapy, everyone could benefit from it. It's basically like, you can think of it as physical therapy for your tongue. Your tongue is the orchestrator of all the muscles around your jaw. So if we can properly, teach kids or anyone, honestly, like that tongue seal to your palate, because that'll facilitate mouth seal as well, proper swallowing patterns. So that all facilitates jaw function, muscular function. We believe a lot of joint issues are also muscular based. So if we can figure that out early, do expansion if we need to, we can just kind of do slow growth instead of doing something like braces where we got to do it really quickly, because that's really harsh on your jaw as well. Yeah. So all of that, just like focusing on slow, natural growth is kind of how we.
Well, my only disappointment is I've met you after 4 of my kids have already been old enough to need braces. So
I'm thinking all the 5 that I have.
Well,
that was expensive.
But for all you young parents out there, if you want to buy a new car instead of putting braces on your kids, maybe this is a good alternative. So.
Well, now he's got me curious about sleep apnea. If there's because usually that correlates to weight. That's that's a normal, kind of precursor for sleep apnea. But I'm thinking about my own husband and the fact that I have to get away from him sometimes in the middle of the night because of it. But he's noticing that it's his jaw that's falling backwards, and he doesn't have wisdom teeth, and all of these things. So I'm just like, So I mean, is there hope for someone who's already done all the damage and now here they are, or is it like, well, this is your consequence for doing that?
No, I mean, there's always hope. You might not be able to expand it as much as when, you're a kid, but just through like kind of management techniques, doing mouth taping, that's a big way to like kind of facilitate more optimized breathing. Nasal breathing is better. It's better for oxygenation. It teaches you all the other stuff that I was talking about earlier, like the palatal seal. But I mean, usually even orthodontics, sometimes traditional orthodontics focuses on retractive, where like kind of how you're talking about how the tongue and jaw go backwards. But everything I was talking about earlier is where we facilitate everything coming forward. So your tongue is not going back in your throat and blocking your airway.
Literally choking you out.
Yeah. So it's honestly kind of scary to think about sometimes when people are sleeping, they're gasping for air, but that's what it all roots to. So your airway has a big role in everything and how your jaw develops. So, but no, I would just focus, like, there are devices out there that can kind of bring the jaw forward, open up the airway. That might be a good option. Mouth taping if possible in, less severe cases. But no, there's never no hope.
Oh, I love that part. There's never no hope.
Yeah.
I love that.
Any parting thoughts? Anything that we didn't cover that you'd love to just share a little bit more about?
I think we covered a lot of like the big kind of realms of our world, and I'm excited to see how holistic and biologic dentistry grows over the next few years. And honestly, getting connected with you guys too, this has been great. So we can figure out more links with the hormone
Sounds like
therapy
a part
as well.
2.
Yeah. I know. A little future partnership there.
Yeah.
Well, thank you for putting in the work. I mean, as someone where we are going against the grain, right? There's nothing wrong with traditional medicine. There's nothing wrong with traditional dentistry in certain, cases. But I think having an option for people who want to go a different path and there's science behind it. I always say, like, we're not practicing, cuckoo medicine. Like there's tons of benefits and evidence to support why we do what we do, why you do what you do. And I think just having an option, right? I think people want that. And so, but kudos. I know the pressure and the criticism and what that often probably feels like sometimes when your colleagues who graduated with you are like, what are you doing? But I just know that path is narrow, but I applaud you greatly.
I appreciate it. The world will get there one day. Yeah. That's my belief. And honestly, my suggestion to anyone is if they're looking for that type of dentist in their area, go to the IAOMT website. They kind of have listings of holistic and biological dentists in the area and what the nearest option will be. And if you're even interested at all, that would be a good place to start. Just get everything checked out by someone who does it in a comprehensive, holistic way. And just let that shape your beliefs and kind of go from there. Go out, get your own info, do your research. I feel like that's the number one best step anyway. So that would be my suggestion to anyone. That's
great. And we'll link your information in the details in the podcast notes and things like that so that people can find you guys and follow you on social media and all the things.
All the fun stuff.
Well, thank you, man.
Yes,
so great
thank you
to be here.
Thank you so much.
Super happy to got the chance to get here.
Yeah. All right. Well, thank you guys for listening, and until next time.